Hi, my name is Chatrath. I'm also known as Baby Catcher to some of the people who know me and know the deliveries that I've done. I'm a registered midwife at West End Midwives. I've been a midwife for 10 years and I'm really excited about that. Midwifery has been in Ontario for about 27 years and we've been at Humber River for the last 2 years. So I feel like this question has a lot of layers to it, and I feel like it's really important to recognize that racism has always existed, and COVID did not make racism happen, but it has perpetuated and exacerbated some of the circumstances and barriers that people do face. And many of the African, Caribbean, Black community have been losing their lives, have been saying that they felt discriminated against, that they felt that they haven't had their voices heard for many years, decades, even centuries to recognize that. I think it's really important to just recognize that there are some groups that, such as Indigenous and Black communities, that are more discriminated against, that it's important to recognize that there are systemic racism that happens and that there are some groups that are just more likely to going to be negatively impacted from the social determinants of health. I think it's really important that we acknowledge that racism happens, but I think it's really important to really understand the mechanisms that continue to perpetuate these things and the barriers that are there. And I think we need to understand how can we remove those barriers so that racism doesn't continue to exist. I think it's really important to have platforms like this so that we can speak up, that we can have a voice, so that we can share our stories, kind of like what we're doing right now. I think it's really important to just be allies, to really educate. People really need to educate and understand what's really going on. I think we need to avoid complacency too as well. Like, we cannot pretend that these things don't happen. They do, and we want to recognize that all of these things are happening. And what I would really encourage for people is, help people. Be a good Samaritan. If you see someone in need, just do something about it. You do not need to be a healthcare provider to make a difference in the world. And I think it's really important that we all kind of do our part. And I feel like just being a midwife and giving opportunities to people as a Black midwife really helps to do that. And I think we need to really put the community first, right? And we need to have what we call client and family-centered care as well. And I think those things are going to help to help us overcome some of the things that we have been facing when it comes to racism and the pandemic. I know it sounds really weird, but I actually really enjoy being a midwife, and it's one of the things that keeps me well. There's just something about being a midwife that really gives me joy and it really fills my soul. And I also love to do teaching as well. So I do a lot of teaching about pregnancy. I teach first aid and CPR. I talk about mental health. I do other fun things like karaoke and cooking and baking. I like to attend my community church as well. And I just find that those things are really important to just kind of keep me grounded and balanced. But the other thing that really helps me to keep well is that I have a family that's really supportive of my profession and just really supportive of me coming out here and working during COVID. And they are just what keeps me grounded, and they just keep that flame burning. And without them, I don't think I could do a lot of the things. And so these are just kind of the round things that I just do to just help me stay well and healthy. I think it's really important that we have more access to care for our BIPOC community, and I think we need to have more diversity in the healthcare profession, and not just even healthcare, just in general, for better representation. I think it's really important just to understand how things work for people. So imagine you are a Black woman and you're a single parent, and now with the pandemic, for example, you are not able to work. So how do you put food on your table for your kids? How do you pay your bills? What if you need devices for your children, for example? Where is that all coming from? Or what if you are a frontline worker and you have to go? who's taking care of your kids, right? So just really trying to look at the mechanisms and just really understand where people are coming from, and then trying to put things and systems in place that really support our community as well, rather than, like I said, being complacent to everything or just oblivious or just kind of normalizing things when we really know that there is a problem and solution. Until we really do that, we're not really going to see any changes at all.